Well, I think the most important thing is that we talk about not necessarily patient satisfaction or making patients happy, but about the whole patient experience, which is the clinical, operational, cultural, and behavioral aspects of the care that we provide every day in every setting and by every person. And so when you think about patient experience that way, patient flow becomes incredibly important, because if the best way to describe it to me is that our patients suffer, whether they're in the medical practice or in the hospital or in home health. Our patients are suffering. And that's a harsh word, and it evokes kind of a visceral response, but at the same time, that's what's going on. And there's inherent suffering with the diagnosis and treatment, and there's avoidable suffering, which is caused by the dysfunction in the healthcare system. And so the best example that I can give is my own example, which is when I was diagnosed with breast cancer last July. The diagnosis and the treatment all by itself caused suffering. And when I was made to wait, or the call light wasn't answered, or I didn't get the pain medication when I needed it, or I didn't get the discharge instructions to make me successful at home, those are all avoidable suffering. And that's caused by the dysfunction in healthcare. And patient flow ranks right up there as a solution, because when you make patients wait, there are all kinds of issues that come to play. When you put patients in the wrong bed, they stay longer in the hospital. When patients stay longer in the hospital, they get sick. So putting the right patient in the right bed with the right staff is absolutely critical to having the best outcome and the best patient experience. Because ultimately, that's what we all want. We want the patient to be successful when they leave our care, no matter what setting we've provided that care in. And so we think about suffering and the strategy to reduce suffering as compassionate, connected care. And that's acknowledging suffering and understanding that body language makes a difference, and that anxiety is suffering. And anxiety is caused when you have to wait. Anxiety is caused when you have patients in the wrong bed with nurses who may or may not be accustomed to taking care of that patient, when they have to wait in the emergency department and they're in a hall bed, when they have to wait to have their surgical procedure done. So all of those things are causing suffering for our patients. And when you think about the patient experience that way, rather than a score, it resonates to people who got into healthcare to help people. It's more than about the score. It's about improving the overall quality of the experience so that patients have a better outcome.